Every hour counts. Timely collection and transport of newborn screening specimens. What is newborn screening? Since 1963, the United States has been screening newborn babies for inherited endocrine and metabolic disorders. Screening allows for early diagnosis and treatment of disorders that can negatively affect a child's mental and physical health for a lifetime, possibly even causing death if not treated in a timely manner. When a newborn is between 24 and 48 hours old, a health professional will take a few drops of blood from the newborn's heel and apply it to filter paper. The dried blood spot specimen is sent via courier or overnight express shipment to a newborn screening lab to be screened for a number of disorders, many of which are life-threatening. Therefore, it is critical that the newborn screen be obtained at the appropriate time frame and transported to the lab as quickly as possible. Any delay could be the difference between life and death for a baby. Importance of timely newborn screening. Noah's story. Noah was born in June 2009. He was healthy at birth, following a routine pregnancy and delivery. Despite appearing well, Noah came into this world a ticking time bomb. Noah was born with a life-threatening disorder called medium-chain acyl-CoA dehydrogenase deficiency, or MCAD for short.
It manifests itself as life-threatening hypoglycemia, where when your body runs out of calories, usually it turns to its fat stores as a backup source of nutrition. Well, Noah's body couldn't do that, so when he ran out of calories, there was nothing left to burn. And because he was a lethargic baby and one that didn't eat very well, he was in trouble.
Noah's newborn screen was collected at 25 hours of age, but the specimen did not reach the newborn screening lab for another 2 days due to the lack of weekend courier service at that time. Noah left the hospital an apparently vigorous, healthy baby at 2 days of age.
He was a little lethargic and he had a little bit of trouble eating. And everybody told us that because he was born at 37 weeks, that, if we waited until closer to his due date, he would start, behaving more like a normal baby, being more alert, being, more eager about feeding.
Over the next 48 hours, Noah became increasingly lethargic because his body was unable to supply him with enough energy due to his metabolic disorder. At 4 days of age, he stopped breathing. Neither his parents nor the paramedics were able to resuscitate him.
It was the hardest thing that we have ever had to live through, was losing our son.
The following morning, his newborn screening results were completed and showed that Noah had MCAD. His newborn screening results were just 12 hours too late to save him. Noah's parents, Chris and Sarah, have channeled their grief to become advocates for timely newborn screening.
Newborn screening is really an area where the details matter, seconds matter, days matter. Noah only lived for 4 days. He was a baby that was born in crisis. If we could have known what was going on beneath the surface with him, oh my gosh, what we wouldn't have done to try to fight for him.
Wyatt's story. Wyatt was born in October 2015. He appeared healthy at birth. Wyatt's newborn screen was collected when he was 27 hours old. The newborn screening specimen was transported by courier to the newborn screening laboratory in the neighboring state the following day. During the time that Wyatt's newborn screen specimen was being couriered and tested, Wyatt was struggling to eat, but doctors were not sure why. The doctors kept Wyatt in the hospital to keep a close eye on him.
I had this feeling that something wasn't really right with him, and I didn't really know exactly what, but I always felt something was wrong.
At 4 days of age, the critical results of the newborn screen were reported to Wyatt's doctor. These results showed that Wyatt had methylmalonic acidemia. Methylmalonic acidemia is a life-threatening metabolic disorder in which the body is unable to properly break down protein into energy.
It was hard, I just wanted to squeeze him, but I couldn't.
Blood and urine tests were immediately obtained. The results of those tests showed that Wyatt's systems were failing, and he was showing symptoms of methylmalonic acidemia.
I was expecting, to maybe go home within 2 days, but he wasn't really eating.
He was immediately brought by ambulance to a tertiary pediatric hospital where he was admitted to begin life-saving treatment.
The nurse actually was the one who handed him to me, and he looked up at me and he just kind of gave this grin.
Wyatt's mother, Brittany, understands the importance of timely newborn screening because it saved Wyatt's life.
It's really important to get the newborn screening because it saved my kids' lives.
Collection of newborn screening specimen. Education of parents. The first step in the newborn screening process is to educate parents regarding the importance of newborn screening. Many state newborn screening programs provide written materials describing the process, as well as the disorders that are included in the screen. As a healthcare professional, you can emphasize these key points. More than 1 in 800 babies have conditions detected by newborn screening. Newborn screening detects conditions that might otherwise be missed until it is too late. Newborns with these disorders look and act like healthy newborns. There is usually no family history of these diseases. Newborn screening allows health professionals to identify and treat certain conditions before they make a baby sick. Most babies with these conditions who are identified at birth and treated early are able to grow and develop normally and lead normal lives. Newborn screening does not confirm whether a baby has a condition. If the newborn screen shows abnormal results, parents will be notified by their infant's doctor. Additional testing will be needed, and parents should follow the recommendations of their infant's doctor without delay. Importance of accurate, complete, and legible demographics. It is critical that all demographic fields be completed and legible on the newborn screening form. This information will be used to find a baby's family and his or her healthcare provider in the event a screen is abnormal. Missing demographic information may cause a delay that could lead to deadly consequences. Collection of these essential demographics should start at time of admission. The goal should be that the demographics are completed prior to collecting the newborn screening specimen. Completion of the demographics should never delay the timely collection and transport of the newborn screen. Remember, accurately completing the demographics is everyone's responsibility. Newborn screening collection. The newborn screen should be collected when infants are between 24 to 48 hours of age, with a target of collection at 24 hours of age. If an infant is going to get a transfusion, the newborn screen should be collected prior to the transfusion, even if the infant is less than 24 hours old. Another screen should then be collected 48 hours later on babies who received a transfusion. Please check with your state's specific guidelines regarding a newborn screening of premature and sick infants for further clarification. Step 1. Demographics. Verify that the demographics on the newborn screening form are complete, legible, and accurate. Step 2. Supplies. Gather the necessary supplies: blood collection card, gloves, heel warmer, sterile gauze pad, sterile pediatric lancet, sterile alcohol prep. Step 3. Preparing the infant for the procedure. Verify that the infant and the blood collection card demographics match. Keep the infant warm and comfortable by swaddling. Only one leg will need to be exposed for the procedure. Letting the infant suck during the procedure can help soothe and calm the baby. If parents are present, they can assist by allowing their infant to suck their finger. Otherwise, a pacifier can be offered if parents are comfortable with this option. Assess the infant's heel for previous heel sticks that might have been performed for bilirubin or glucose checks. If the selected heel appears to have been used for other procedures, use the other heel if possible. Once the heel has been selected, identify the puncture site. Place the heel warmer over the puncture site for typically 3 to 5 minutes, or as instructed on the warming device. Using a heel warmer will increase blood flow to the site. Newborn screening collection protocols may vary. Check with your institution regarding the use of heel warmers and puncture devices. Step 4. Collection. After allowing the heel to warm, cleanse the site with alcohol prep. Allow to dry completely, as alcohol can contaminate the blood specimen. Position the foot lower than the heart to allow for good blood flow. Puncture the heel with the lancet. Wipe away the first blood drop with a sterile gauze pad. Allow another large blood drop to form. Be patient, as this may take some time. Collecting a large drop of blood is essential to ensure a sufficient quantity of blood and complete saturation of the blood through the filter paper. If you are having trouble obtaining a large drop of blood, you can try these techniques to encourage blood flow. Apply pressure, beginning at the top of the leg and working down to the heel. Gently squeeze and release the area of the foot around the puncture site. Vigorous squeezing or milking of the foot will result in serum separation. After the blood has been collected, the baby's foot should be elevated above the body and a sterile gauze pad gently pressed against the puncture site until the bleeding stops. Do not apply additional blood to a spot where blood has already been applied. This causes a layering effect. Do not apply blood to both sides of the card. Once specimen collection is complete, it's a good idea to have a designated person at your facility do a spot check. The spot checker can determine that sufficient blood has been collected to fill the circles. Determine the blood saturated through the filter paper. Ensure that each circle only contains 1 drop of blood and the blood is not layered. Ensure all the demographics on the card are accurate, complete, and legible. Air dry the collection card horizontally for only 3 to 4 hours on a dry, clean, non-absorbent surface. Horizontal drying allows for improved saturation of the filter paper. Consider using a drying rack. Step 5. Unsatisfactory specimens. We will review the most common reasons specimens are classified as unsatisfactory or invalid for testing. Insufficient quantity of blood is caused when there is not enough blood applied to each of the dotted circles on the filter paper, and there is not enough blood to conduct all the necessary testing. This can be corrected by ensuring a large drop of blood is allowed to form before applying to the filter paper. If you are unable to obtain a large drop, try intermittently applying pressure to the top of the leg and work down to the heel, as this may help in collecting a sufficient drop of blood. Incomplete saturation is caused when the blood does not soak all the way through to the back side of the card. This can be corrected by ensuring the blood completely saturates the filter paper and coverage extends to the boundary of each dotted circle. Additionally, drying the card horizontally will allow gravity to help pull blood all the way through the filter paper. Multiple application of blood is caused when blood is applied in the same spot over and over again, resulting in a layered effect. It can also occur when blood is applied to both sides of the paper. This can be corrected by making sure a large enough drop of blood is allowed to form before applying to the filter paper. Do not apply blood to a circle where blood has been previously applied. Only apply blood to one side of the filter paper. If you are concerned that the specimen may be deemed unsatisfactory for testing, destroy the card and recollect a new sample immediately. The best time to ensure a good specimen is collected is when the baby is still within your facility. If a specimen is deemed unsatisfactory for testing, it will need to be recollected. This could result in dangerous or even deadly delays while waiting for the baby to return to a hospital for a repeat specimen. Remember, when in doubt, throw it out and recollect. Step 6. Package for transport. Dried blood specimens should be received by the newborn screening laboratory within 24 hours of collection. Use your state's preferred method of transport, either courier or overnight express shipping. It is critical that your staff knows the scheduled pickup time so all specimens are packaged and ready to go by the specified time. Blood collection cards should never be batched, but rather sent to the newborn screening lab every day. Maintain tracking documentation at your facility and record pickup and delivery times. Also include a list of specimens being sent to the newborn screening lab to help track any specimens that may be lost in transit. Laboratory process. The journey of the blood spot. The specimens are dropped off at the newborn screening lab by a courier or overnight shipping company, ideally within 24 hours of collection. The goal is to process and run the specimens the same day of receipt. The laboratory staff collects all available specimens and takes the specimens to the lab for processing. The specimens are removed from the packing envelopes and sorted. All specimens are checked for quality. Any specimen that is deemed unsatisfactory for testing will be removed from processing. The submitter is alerted of the unsatisfactory specimen with a request made for immediate repeat specimen collection. This significantly delays the timeliness of the newborn screening process, as frequently the infant has already been discharged from the hospital. Specimens and demographic information slips are labeled with a unique identifier so that specimens can be electronically tracked throughout the testing process. Several 1/8 inch or 3 mm discs of filter paper are punched into plates to begin the testing process. Once all specimens are punched, the plates are distributed to different laboratory benches where they are processed and tested for a number of life-threatening disorders. Typically, testing is completed within 12 to 24 hours. The results are reviewed and verified for accuracy. Critical results are urgently reported to primary care providers so that the status of the infant can be checked without delay. The infant may need to be seen at a local emergency department for examination and receive stat laboratory studies. If necessary, the infant may need to be referred immediately to a tertiary pediatric hospital for initiation of life-saving treatment. Review and conclusion. Everyone involved in newborn screening wants to do the best job possible. Screening allows for early diagnosis and treatment of disorders that can negatively affect a child's mental and physical health for a lifetime, possibly even causing death if not treated in a timely manner. Together, we can improve the timeliness of newborn screening and help save lives. Any delay could be the difference between life and death for a baby.
It's really important to get the newborn screening because it saved my kids' lives.
You can ensure that a quality newborn screening specimen is collected at 24 to 48 hours of age and transported to your state's laboratory as soon as possible, ideally within 24 hours of collection.
There's no time to waste. Taking the blood draw, processing it, getting it to the lab and getting the lab results processed and back to the hospital, one day would have saved our son's life.
Thank you for taking the time to view our video. We'd like to thank the nurses and staff at University of Colorado Hospital in Aurora, Colorado, as well as the family of Natalie Burns for allowing us to film her newborn screen. We'd especially like to thank Noah and Wyatt's families for allowing us to share their stories. Lastly, we'd like to thank New Steps 360. New Steps 360 is a collaboration between the Colorado School of Public Health and the Association of Public Health Laboratories.